Ramsay Hunt syndrome. NORD gratefully acknowledges Daniel Kim, MD, Emergency Ultrasound Fellow, Denver Health Medical Center, Emergency Medicine Resident, University of Toronto, for assistance in the preparation of this report. Synonyms of Ramsay Hunt syndrome. Ramsay Hunt syndrome (RHS) is a rare neurological disorder characterized by paralysis of the facial nerve, facial palsy, and a rash affecting the ear or mouth. Ear abnormalities such as ringing in the ears, tinnitus, and hearing loss may also be present. Ramsay Hunt syndrome is caused by the varicella zoster virus, VZV, the same virus that causes chickenpox in children and shingles, herpes zoster, in adults. In cases of Ramsay Hunt syndrome, previously inactive, dormant, varicella zoster virus is reactivated and spreads to affect the facial nerve. Signs and symptoms. The symptoms of Ramsay Hunt syndrome vary from case to case. Affected individuals usually experience paralysis palsy of the facial nerve and a rash affecting the ear. These two symptoms do not always occur simultaneously. In most cases, only one side of the face is affected, unilateral. Facial muscles affected by nerve palsy may be weak or feel stiff and may result in the inability of affected individuals to smile, wrinkle the forehead or close their eye on the affected side. In some cases, speech may become slurred. Additional symptoms affecting the ear include ringing in the ear, tinnitus, and ear pain, otalgia. In some cases, ear pain may be intense. Pain may spread to affect the neck. Some affected individuals develop sensorineural hearing loss, a condition in which sound vibrations are not properly transmitted to the brain due to a defect of the inner ear or the auditory nerve, resulting in hearing loss. Hearing loss is usually temporary, transient, however, in rare cases it may become permanent. Additional symptoms that may be present include nausea, vomiting, and a sensation that one's surroundings are spinning, vertigo. In rare cases, loss of taste, dry mouth, and dry eyes may also occur. Causes. Ramsay Hunt syndrome is caused by the varicella zoster virus, which is the same virus that causes chickenpox and shingles. The virus can remain dormant for decades in a person who has had chickenpox as a child. Reactivation of the varicella zoster virus results in shingles and, in some cases, develops into Ramsay Hunt syndrome. The reason why the virus reactivates and affects the facial nerve in Ramsay Hunt syndrome is unknown. Affected populations. Ramsay Hunt syndrome affects males and females in equal numbers. According to one estimate, 5 out of every 100,000 people develop Ramsay Hunt syndrome each year in the United States. The disorder is the second most common cause of atraumatic peripheral facial paralysis. Some researchers believe cases of Ramsay Hunt syndrome go undiagnosed or misdiagnosed, making it difficult to determine the disorder's true frequency in the general population. Related disorders. Symptoms of the following disorders can be similar to those of Ramsay Hunt syndrome. Trigeminal neuralgia, also known as tic douloureux, is a disorder of the fifth cranial nerve, trigeminal nerve, characterized by attacks of intense, stabbing pain affecting the mouth, cheek, nose, and/or other areas on one side of the face. The exact cause of trigeminal neuralgia is not fully understood. For more information on this disorder, choose trigeminal neuralgia as your search term in the rare disease database. Diagnosis. A diagnosis of Ramsay Hunt syndrome is based on thorough clinical evaluation, a detailed patient history and identification of characteristic symptoms, i.e. facial palsy and rash. Viral studies can detect varicella zoster virus in saliva, tears, and blood but are not necessary to establish a diagnosis of Ramsay Hunt syndrome. Standard therapies. The treatment of Ramsay Hunt syndrome commonly involves antiviral medications, like acyclovir or famciclovir, in conjunction with corticosteroids, like prednisone. Most authorities agree that beginning antiviral treatment within 3 days of onset appears to have the greatest benefit, as prompt diagnosis and management seems to improve outcomes. Despite therapy, some degree of facial paralysis and hearing loss may become permanent in some cases. Further treatment is directed towards specific symptoms that are apparent in each individual. This includes pain medication, carbamazepine, an anti-seizure medicine which may help reduce neuralgic pain, and vertigo suppressants like antihistamines and anticholinergics. Investigational therapies. Information on current clinical trials is posted on the Internet at www.clinicaltrials.gov. All studies receiving U.S. government funding, and some supported by private industry, are posted on this government website.